We're at a unique time in history when physicians still circumcise the majority of American baby boys. We believe that we're in a period of change and that physicians will soon stop circumcising, hopefully in our lifetimes. When physicians do stop, everyone will want to forget as quickly as possible that it ever happened. We made this video so people will remember.
Coming right out of residency, it would never occur to me not to. It was a procedure that we performed for the parents, and it really, I haven't been out in practice long enough to really think, ethically, is this something that should or shouldn't be done?
When you are an intern or a senior medical student, when you begin performing these procedures, it's done because you are expected to do them, because that's part of what an intern does. And it's not questioned whether it's your principle to do it or not. At least this was my experience. That was part of our duty.
I don't think I did a lot of thinking about it, and it was actually, I felt like I was actually doing something good at the time, because it was, as a medical student, you do a lot of watching, and you don't actually get to do a lot of participation. And it's one of the things they actually allowed medical students to do.
It was a fairly busy OBGYN service, and the interns who did the deliveries were responsible for doing the circumcisions on the newborns the day following. And there would typically be, I would say, approximately 10, upwards of 10 circumcisions.
We went ahead and did them without any question. The scenario was interesting. In many hospitals, it was that you'd line them up and just do them in an assembly line fashion.
I am a family doctor. Family doctors generally like to do procedures. I like to take molds. I like to do circumcisions. When I have done a circumcision and it looks really nice, I say, "Oh, I did a good job," and I feel good about that. And I feel very comfortable with my skills, and I'd rather do it than have somebody else do it who I don't know what their skills are like.
I understand the rationale behind it, and I don't encourage it. And when I do them, I don't like doing them. And the reason that I do them now is because the parents are patients. They have an expectation that their child should be circumcised, and it's somewhat out of respect for that more than anything else.
There were a few years where I was the main one doing most of the obstetrical and family planning services, which included circumcision. And in those days I was doing them. I was working full-time for the Indian Health Service and was doing circumcisions on the Indian children.
There's many choices that are taken away from the child. And I think that if it's a parent's choice, and here's where my thought comes, it's the parent that's making the choice, not in detriment of the patient. Or at least that's the thought that the parents have. When they're piercing the daughter's ear, it's not so that they can cause suffering of that ear. It's to enhance the beauty of that child. And in that way, I think of circumcision, that the parents, in their belief, are doing something that's good for the child, whether it's because of a tradition of the family, for the harmony of the family, for the religious tradition, or, in probably few, because they think it's medically in the benefit of the child. So that is where I can feel good about doing a circumcision, in that even though it's a choice that's not given to the child and it's taken by the parents are doing it in their thought at that point in time as a benefit to the child.
Even if a person is not very well educated and they're really off the wall in their reasons for doing something like that, they have very strong reasons for doing it. And to me, I don't think circumcisions are mutilation. I think circumcisions are more of a cosmetic, sort of plastic surgery type thing, like taking a mole off of somebody's face or something like that. and I don't feel in my heart that I am damaging this boy for life, you know. And so if the parents feel strongly about it, I go with their wishes.
I remember having to do one on a woman who was 18 years old, had her third child, had no teeth because she'd allowed them to rot, had false teeth, chain smoked, drank, and did cocaine during her pregnancy, had this premature baby come out at 31, 32 weeks that was like 2 pounds, 10 ounces or something. And after nurturing it through the intensive care aspect of the first month, she said, well, you have to circumcise it. And I went, oh, this thing is too little. We can't do this. Why are you going to be cruel? Nope, got to do it. And because she had the authority, we had to give in. And again, that didn't look too good. It didn't feel good doing it. And it did not have any, that particular event didn't have any complications, but it didn't feel right.
It's the parents' decision, and then I'm there to perform a service for them. And if they want the circumcision, I do nice ones, and I think that it's sort of up to me to do that for them. I think it's important for both daddy and the baby to look alike in terms of, the parents' point of view. I think that's important. I think that, little boys do kind of check out what daddy looks like. Daddy has one, mommy doesn't have one, does mine look like daddy's? I think that does factor in when you're little. I think it makes a difference.
My religious background is Jewish, and so it's very much inculcated into my religious background, but I didn't really question whether or not it was something that I should be doing or shouldn't be doing. It just felt like it was just a part of my medical practice, and I just offered it as a service that was requested.
I was doing circumcisions usually at the request of the parents when they, after considering the situation on their own, getting what information and advice that they could get, they requested that I perform the procedure on their boys. This is an example of medicine borrowing from religion, understanding that the procedure any procedure that was requested or in fact required by God must have not only spiritual benefits but health benefits as well.
I say right off, there's no medical reason to perform a circumcision. It hasn't been proved to prevent, significant amounts of infection.
There is not a medical indication for circumcision.
It's considered a social custom that an operator is performing. It's not really for medical reasons because the parents are the issue. The doctors will say it's because the parents wanted it done. The parents, on the other hand, say, well, the doctor did it and we asked him. So there's this collusion that continues, and that's why we still do it, because the doctors too many of them are weenies. They just won't say, I'm not going to do it anymore. It's illegitimate. I refuse to participate in this procedure. There's nothing medical. But we don't have enough doctors saying that.
Well, I think that, circumcision is primarily a cultural phenomenon.
I think the majority have said it's because of the tradition in the family, not necessarily because it's connected to possibly a religious tradition in their past, but just because somebody in their family also has had the circumcision.
The first part of the relationship between man and God involved God's requirement that Jewish children be circumcised. A Jewish ritual circumcision is not what is happening in the hospital. And so really it's not, there is this Jewish effect, but you could counter by saying, well, that is not what God said. God did not say that Steve Lucero is going to circumcise your child on day 2 after birth. God said that on the 8th day, a mohel would come to your home and do the procedure with all the prayers, and that's what the covenant is.
And I've gotten several, dozen, I guess, under my belt, so to speak, and I didn't feel good about any of them. I didn't like it, but I did them, and I always was very precise about everything I did. I did electron microscopy research, so I was used to very precision movements with little buttons and gears and things, and so a circumcision to me was a very precise thing, and yet you never could get it precise. It just didn't work that way. So I was doing one on this baby, and he started bleeding. And he bled and bled and bled, and I was panicking. And you did him in a locked room, which was very dark, with a lamp, and it was somewhat soundproofed, and it was away from the nursery, so nobody could hear. And it was sort of this weird behavior that you went through where nobody was watching, and you didn't have a nurse, you just did them because you were a resident, you could do anything by yourself. So this baby started bleeding, and I called for help, and the attending, who was a family practice attending, came by and he says, I don't know what's going on. He says, this blood vessel shouldn't be there. So we called in a pediatrician. He says, I don't know any more than you do. What's going on? Called in a urologist. This was all within the space of 10 minutes. And the urologist said, well, this blood vessel doesn't exist in this part of the penis normally. What, you know, he didn't know what was going on. We called in a plastic surgeon. We finally had to transfuse the baby. And this was 5 doctors sitting around this 6-pound screaming, bleeding infant trying to stop the blood loss. And we finally got it clamped, and I'm sure we made a mess of it. And you know, we never told the mom. Never told her anything. Except, why is my baby getting blood? Well, you know, it lost a little blood during the circumcision, but no big deal. And that was sort of what you did to cover up these things, and it still goes on. It hasn't changed. That was in probably 1981.
Doing circumcisions, I mean, even if you give anesthesia, some of the babies, you know, scream and, you know, they struggle, and some of them do less of that, but it's just not a very pleasant experience. They, you know, there's babies are crying, and, you know, the parents are, you know, some of the parents chose to be in the room, some of them chose to be out of the room. If they were in the room, you know, it was usually, you know, difficult for them to be there. Even if they were out of the room, you know, sometimes, you know, I would come out there and the mother would be in tears. You know, this wasn't always the case, but, you know, there was certainly enough of those that that you could see that the parents were, some, you know, parents had ambivalent feelings about it, and it was difficult for them to see their babies in pain.
Overall, procedure seemed odd in that the way I began putting it together, you were taking an infant male, and the first genital experience that the child was being given was one of pain, and I found that to be bothersome. And in my own way, I felt it was a little bit unusual to then take this male infant that you'd given genital pain to and put it to the maternal breast. And I felt that it just seemed that we were giving a message to infants that I didn't feel comfortable with.
Every circumcision that I have done, you know, I know that the baby is feeling something. When I do a dorsal penile block, I know that the baby is feeling that. Sometimes the blocks work real well, and I use a Gomco, and when I tighten the Gomco, by that time, then the baby sort of calms down. But up until that time, it's traumatic, I think.
The whole question about when people change their minds and how people change their minds is an important issue, and I think that people in life do change their minds. In this case, I will say I can not conceive of anything that would make me change my mind. To be honest, I think that if there were a devastating complication of a circumcision procedure in someone close to me or in a family member, that would certainly make me think twice about the procedure, or if I were aware of increasing complications from circumcision.
And the nurse sitting next to me at the newborn nursery counter was holding this crying, screaming baby boy, who had been circumcised. And she said, would you look at this and tell me what you think? And I said, well, it's not my patient, but I guess. And so I looked, and this baby had been skinned. The entire foreskin and the skin of the shaft of the penis had been taken down to the abdomen. So he'd lost his entire penile skin, which is an automatic lawsuit. It's automatic malpractice. There's no question about it. It's horrible. It's poor operator. It's a stupid scenario. It should never occur. So I said, well, you know, this And she said, well, that's what I thought happened. I said, well, it's pretty obvious, isn't it? The whole penis is bleeding. There's no skin all the way to the root of the penis. The abdomen has been taken all the way off. This will be a scarred up boy for life. There's nothing you can do to make this be anyway normal. It's not a normal circumcised penis. It's an abnormal circumcised penis forever.
I think if I had lots of people come to me, males, adult males, come to me and say, you know, I really wish I hadn't been circumcised, that really distresses me or makes me feel that I can't function or that is really traumatic for me. Or if I found that the procedure on a newborn was very traumatic for them, I feel like they tolerate it pretty well. And so I think those would be the two factors that would have to, sort of arise for me to consider not doing circumcisions any longer.
If I had strong scientific data that would show to me that there is emotional trauma, yes, I would be against it. If I got to where I just didn't respect that parents have the right to make decisions for their kids, then I probably would stop. Or if I got to feeling like I was really doing harm to the child, then also I would stop.
About a year ago, I finally stopped doing them, primarily because I just felt like I didn't enjoy doing the procedure. It was a stressful procedure for both me and my nurse and obviously the babies. And it wasn't something I enjoyed anymore. And I came to a place of realizing that, number one, if parents wanted to have this done, there were other physicians in the community that could offer that. And I wanted to be spending my time doing things that I felt was more useful than doing circumcisions. So it hasn't been anything I've missed.
Well, over the years I've evolved from saying, well, I'm not going to do this, I don't do these anymore, which was an easy thing to say after a while, and it felt good, to talking about other things that were more important. And I evolved from talking about why I won't do it, or why I didn't do it, why I stopped, why I won't do it, to not allowing a referral.
I went in to speak with the mother of an infant and asked that she just listen to my little spiel on the risks and the benefits. And she essentially told me that she didn't really care what I had to say, that she just wanted me to do the circumcision and just do it. And maybe I was tired from a long night, or maybe it was just the right timing, but I just decided then and there that I'd finish doing circumcisions and I wasn't going to do any more. And that if somebody wanted to have their child circumcised, they could certainly find somebody else to do it, but it wasn't going to be me anymore. I think that in life you just draw the line in certain times about things that are important to you or not important to you, and you choose things that are important, and sometimes you know that you're making that choice, and other times I think you don't really know.
This is a dilemma, and I don't like doing them. And I sit there and I think, well, should I keep doing them? And it's this thing I struggle with because I don't really like doing it, and I don't think it's necessary. And, and I might stop doing them.